13-year-old KAITESI SHINAH is laying on her hospital bed. Her upper body motionless, while her lower body makes endless movement. Her eyes are fixed in the roof, with a pen passionately held in her right hand before she rose to her right to ask for a book. KAITESI was diagnosed with leukemia last year after battling with incurable fevers for 2 months that forced her exit from school.
I was at school when I started having some fevers. These fevers took long, like for 3 to 4 weeks. But I could not tell my mom because I knew that at school it could be cared about.
KAITESI SHINAH's unkempt hair is the least of her worry, but the vacuum of being out of school gives her silent screams, but only this book has been able to fill those empty spaces. Leukemia comes about when large numbers of abnormal white blood cells are produced in the bone marrow, hence flooding the blood. Leukemia, like the other common cancers, presents minor signs that sometimes make it hard to reveal the disease.
I started feeling pain in my lungs, breathing was difficult. I was just like I couldn't do anything for myself.
KAITESI, however, received on and off fevers before she was diagnosed with the disease. Leukemia is one of the most common cancers in Uganda, whose killer instincts remain rampant due to limited medical expertise to respond. KAITESI was brought to the makeshift Mulago Cancer Ward 6 months ago with the help of an onrushing mother who had stayed awake in panic the night that followed due to a helpless daughter writhing in pain.
One night, I did not have even sleep with my mom. I was telling her, change me this side, change me this side, this way, right, left, but I couldn't feel comfortable at all.
During her stay at the facility, KAITESI has married the book that continue her passion for books. Despite the ordeal, her bright looks show no signs of despair, but bravery in the face of fright. Her writing skill is still sharp due to the constant scribing. Her story as a leukematic patient is one not easily shared by those facing similar plight who die in silence.
It doesn't scare me anyhow, but because I have my faith, I know God will do it well for me. And I'll go out of here to help other people, and I tell them about it, how I've faced it and how I've experienced it.
KAITESI has withstood the emotional tragedy of having to lose her ward colleagues on a daily basis, run across her face on rolling beds by hospital staff headed to the mortuary. Just 2 days ago, her roommate, the name concealed for the respect of the deceased family, passed away after conceding the fight to cancer. Her situation, however, is unfortunate. Unlike most who don't survive the first weeks when rushed in, KAITESI SHINAH's recovery has been a fairy tale. She can't wait for her discharge day to be able to complete her studies, hoping to later become a doctor.
I want to be a doctor because there are little doctors around here. There are few doctors.
However, her desire may not easily be realized with a society of prejudice in her wake.
My start Cancer Institute has not been bad at all, though I'm finding some problems. Some of my friends left me, and then again my studies is a problem. My studies stopped because I'm here. I could have been at school.
Zahara Namuli, NBS Sunset.